Well, for more on the benefits and risks of playing sports during a pandemic, I spoke with Daniel Kelly. He's an academic director at the New York University Institute of Global Sport. And he began by talking about why adolescent girls are better off with less screen time.
You're seeing that the social element is adding to their aptitude to increase within their schooling as well as their social activity. And so what we're seeing is that the emphasis on youth programming has been allowed to give girls the opportunity to build their confidence. And by building their confidence, we're seeing that the result is leading to increases in the ability to perform within school as well as within their families. And so for positive results, we're seeing these emphases to be quite positive.
And we're seeing that extracurricular activities are an asset for thriving in adolescence. Talk about what it means for young people on a day-to-day level.
On a day-to-day level, the key term is access. And so if you have, for wealthy families who have access, the pay-to-play model has been the biggest benefit for the coronavirus, or combating the coronavirus and the restrictions. And so what we're seeing here is that the pay-to-play model is allowing them to still provide access to students for sporting activities and also allowing them to provide opportunities for social enhancement and social adjustment as well.
Now, as we're seeing, though, middle-class and wealthy families are far more likely to have found workarounds for the coronavirus restrictions and to keep their children playing. But what does this loss of momentum mean for people who don't have that sort of access?
What we're finding is that in urban areas, a lot of the programming and budget cutbacks are negatively impacting after-school programs for youth. And so there's a program in particular called DC Scores, which is part of the larger institute called America Scores, which is a program focused on soccer, creative writing, and community service. These types of after-school programs are lacking in funding and thus lacking in opportunities for the youth in the urban areas.
Now, it's hard because depending on your school district, you may be restricted just to virtual schooling. So in turns, you have kids having a lot more screen time than they usually would, and they're also sitting down for longer periods than they should. What are the consequences of having that? And if anything, what can parents do to try and counter some of the effects?
The biggest effect is going to be the engagement. When you have sedentary children, then they start to develop bad habits, and that can lead to a lot of physical issues. And so by providing an outlet for students in a safe environment to be able to engage with others who have also followed the COVID protocols, that's the safest bet for having activities within youth.
Now, different types of sports and activities offer different levels of risk. So how do public health officials and parents really balance these risks of the pandemic with the benefits of these extracurricular activities in youth? Is there a right way?
I found that the CDC has put together a great list of mandates, but what I'm finding is that at the state level, the actual implementation of these mandates is where we're seeing the biggest change and the biggest efforts. The Connecticut Department of Public Health has created a three-pronged approach, going from higher risk to moderate risk to low risk, and they have put sports like football and rugby into the higher category of risk. Moderate risk is sports like basketball and baseball, and then individual sports like golf and tennis fall into the lower risk categories. And so with each risk category comes with a different set of protocols and procedures for proper COVID-19 prevention. And I think that the Connecticut Department of Public Health has done a fantastic job by providing this benchmark that can be used for other countries, other states.
And it certainly does vary from state to state. So in terms of the funding gap, what you're seeing in the states that are doing it right and the states that are really struggling, how big is the shortfall?
I would say the shortfall is very, very significant. And so the more affluent states, we're seeing increased programming, increased promotion, we're seeing commercials, we're seeing opportunities for the word to get out. And then in lower impoverished areas, we're seeing the lack of a messaging is not really reaching the masses. For instance, a lot of the programming and messaging is being sent via digital means or is sent via commercials. And so in lower impoverished areas where they don't have access to the internet or access to these portals, they're not getting the information as the same as their other counterparts.
So just quickly then, what sort of behavior should parents and other adults then be trying to model to help support young people to stay healthy?
The biggest key is to follow the COVID-19 protocols, the safety protocols, and to really focus on social distancing. And one of the major issues that was coming out of New Jersey was that indoor hockey was leading to an increase in numbers. And the fact that we can use contact tracing to find out what was happening allowed them to put prevention methods in place to prohibit indoors hockey. And so my best advice moving forward would be to follow the protocols, but more importantly, to pay attention to the public health officials and their renderings of what the best safety protocols should be.